Hey friends, welcome back to the channel. Today we're going to be looking at an OSCE setting of taking a medical history. So it's very important to be completely formal and imagine that a real patient is actually present at the scenario. You may have an actor there, or you may be actually communicating directly to the examiner. So it's important that you politely introduce yourself. Say, hello, my name is Dr. X, and I'm going to be asking you a few questions in regards to your medical history. So start off by, are you generally fit and healthy? It's a good open question to ask. And then you can get into more specifics at a later point. Do you have any heart problems? Any blood pressure issues? Have you had any history of rheumatic fever or infective endocarditis? Moving on to the chest. Do you have any breathing difficulties? Do you have asthma? Do you have COPD? Next. Are you allergic to any substances or drugs? If they are, then delve into it a bit more specifically and find out what they are allergic to. Are they allergic to penicillin? Are they taking any drugs or medications, whether they are prescribed by the doctor or not? Are they suffering from any long-term illnesses? Have they attended hospital recently? Have they or been diagnosed with epilepsy? Any bleeding disorders? Diabetes? Hepatitis? Jaundice? Tuberculosis? So if they've got any bleeding disorders, we need to determine what kind of bleeding disorders do they have. Is it acquired or is it inherited bleeding disorders? Are they taking warfarin? Are they taking other blood thinning medication that we need to be aware of? Could they be pregnant? It's important to also incorporate this into the medical history, but it usually is under the setting of social history, but it's actually good to include this. Smoking history is important to ask. How many do they smoke? What do they smoke? And when did they start? Ask them about their alcohol history. How much do they drink on average? And what do they drink? More specifically to today's scenario, it's also important to ask if they've had any COVID symptoms. Well, thank you very much for listening. We hope you find the video beneficial. If you did, then please kindly like and subscribe to our channel, and we'll be bringing more videos for you in the future.